Hi guys, Dr. Rob Barrington here with some more nutrition advice. I'd like to talk today about niacin and some of the interesting effects that niacin has in human metabolism. Now, niacin is actually a generic term for vitamin B3, and vitamin B3 is made up of nicotinamide and nicotinic acid. They both possess the same activity in terms of vitamin B3 in the body. Now, at normal dietary intakes, vitamin B3, both nicotinic acid and nicotinamide, are required for the formation of the coenzymes nicotinamide adenine dinucleotide and nicotinamide adenine dinucleotide phosphate. They're abbreviated to NAD and NADP, and these two substances are they're electron carriers, and they're used by the cells as dehydrogenases. They accept electrons and they transport these electrons around the cells. In the case of NAD, the electrons are taken to the electron transport chain to produce energy from both the citric acid cycle and glycolysis, and in the case of NADP, the electrons are used for synthesis reactions. So these chemicals, NAD and NADP, are important. They have interesting cellular effects, and if you've ever studied biochemistry at degree level, you will have come across them, no doubt. However, niacin also has, as well as these normal functions, it has some interesting pharmacological properties in humans, and it's really the pharmacological properties of niacin that I wanted to talk about today. Now, there are two compounds, as I said, that make up niacin. There is nicotinic acid and nicotinamide. Now, nicotinic acid, when it's taken in very high concentrations, what we're talking about intakes of over a gram a day, causes a dilation of blood vessels. Now, when you take nicotinic acid, you can feel this after a few minutes. You get a flushing sensation in your skin becomes very itchy, and you see redness there. And this is the dilation of the blood vessels in the skin, increasing the flow of blood to the skin. Now, this is quite harmless. This flushing effect is evident, more evident in some people than others. It is quite harmless, but it does have an important pharmacological effect, and because the blood vessels are dilating, they are decreasing the peripheral resistance to blood flow, and therefore your blood pressure decreases. So nicotinic acid actually has a blood pressure lowering effect. That may have beneficial effects against cardiovascular disease in the long term. Now, if we look at nicotinamide, there are also pharmacological effects relating to cardiovascular disease in nicotinamide. If you take gram amounts of nicotinamide, what you tend to find is that your blood cholesterol levels improve. Now, in particular, the amount of low-density lipoprotein will decrease. Also, the amount of lipoprotein A will decrease, and also the amount of very low-density lipoprotein will also decrease. Now, very low-density lipoprotein is manufactured in the liver, and it's made up mainly of triglycerides. Very low-density lipoprotein is actually called triglycerides when it's measured clinically. Now, it appears that nicotinamide is able to decrease levels of very low density lipoprotein because it inhibits the synthesis of triglycerides in the liver, and therefore there are fewer to be placed into these lipoproteins, and therefore your levels in your blood decrease. Now, because very low density lipoprotein is a precursor molecule for low density lipoprotein and lipoprotein A, levels of those two lipoproteins also decrease. Now, lipoprotein A, low density lipoprotein and very low density lipoprotein are all associated, if they're in high amounts in the plasma, with cardiovascular disease. So lowering them may have some beneficial effects on cardiovascular disease. However, it is very important to understand that that is an association, it's not a cause and effect. There is an association between high levels of low-density lipoprotein and cardiovascular disease. There is an association between levels of lipoprotein A and cardiovascular disease. And there is an association between levels of very low density lipoprotein and cardiovascular disease, but there is no cause and effect. It's an association. So whether pharmacological amounts of nicotinamide are beneficial in the long term, it's not known. It has been clinically tested, and it is as good as most of the available pharmaceuticals at lowering cholesterol levels for those lipoproteins. Another benefit that nicotinamide has over pharmaceutical drugs is that it also increases levels of high density lipoprotein. Now, high density lipoprotein is inversely associated with cardiovascular disease, so when your levels go up, you're actually you have a certain protection from cardiovascular disease. So nicotinamide actually increases the beneficial cholesterol, HDL, and it decreases the detrimental cholesterol carriers, lipoproteins, LDL, VLDL, and also lipoprotein A. So there may be cardiovascular benefits from taking nicotinamide. The disadvantage of taking nicotinamide in gram amounts, over about 3 grams a day, it may cause liver damage, and it also has detrimental effects on your blood glucose levels. So it's not really something that should be recommended in terms of being taken as a nutritional strategy to improve your health, but it's just nice to highlight that these nutrients do have effects that are comparable and better often than pharmaceutical drugs. Of course, pharmaceutical companies are not interested in nicotinamide or nicotinic acid because they are vitamins, they're not patentable, and they can't make money from them. But they do have these effects, which are really as good as anything the pharmaceutical companies can produce. It's interesting from a biochemical point of view. I wouldn't recommend that you go about taking niacin as treatment for anything at pharmacological levels, because although research has looked into them, and yes, they have less side effects than the pharmaceutical drugs, yes, they are as effective or more effective than pharmaceutical drugs, there are better ways to protect yourself from cardiovascular disease than taking high doses of niacin. A high quality diet, a traditional diet that contains lots of plant foods, contains good sources of protein, contains all the vitamins and minerals you need, that is absent of metabolic poisons like fructose and trans fatty acids, is a way that has been proven over the long term in epidemiological studies, in clinical trials, to lower cholesterol levels. It will improve your blood sugar levels, it will improve your insulin sensitivity, and it will reduce your risk of cardiovascular disease, and the side effects are zero. You have no side effects from eating a high quality diet. So the take-home message from this is that nutritional biochemistry is very interesting. These substances, when they're taken in, some vitamins, when they're taken in high amounts, do have pharmacological activity, and it's very interesting to look at this activity because it does give you insights into how the body works. But nutrition doesn't work like drugs, or it shouldn't work like drugs. Nutrition is about looking after yourself, nutrition is about taking exercise, and it's about eating high quality foods. If you are interested in protecting yourself from cardiovascular disease, if you're interested in reducing your cholesterol levels, if you're interested in lowering your blood pressure, I would suggest that you look to a high quality diet, look to a traditional diet like the Mediterranean diet, and have an interest in those pharmacological effects of nutrients. But really, if you're eating a high quality diet, you shouldn't need to take pharmacological levels of substances like niacin, and that will keep you safe because there is no side effects to taking a high quality diet. And if over the long term you do eat a high quality diet, you'll get all the other benefits, including weight loss. Your skin will look better, you'll feel healthier, you'll have higher energy levels, and really you won't just be protecting yourself from cardiovascular disease, you'll be protecting yourself from all of the Western lifestyle diseases, including type 2 diabetes, cancer, and obesity. So I would suggest that if you're interested in being healthy, that you look to the traditional diets, things like the Mediterranean diet, and you do your own research. And really, if you do eat those kinds of diets, you shouldn't really need to turn to drugs or pharmacological levels of any of the nutrients that may have these beneficial effects.